mental health issues and distress are not just the realm of teenagers moving into adulthood. Rather, there are mental health issues that affect seniors as well. What additional assistance is being given in the economic update to seniors? In money? Zero. That's not nothing, but it is nothing. And in terms of healthcare, the government is saying we're going to give $1 billion out of 300 and something million for later. That'll be during the election campaign, so $1 billion out of the total. If the provinces give their jurisdiction up and lay it on the feet of the Prime Minister and say, you're the boss here in the healthcare area. Asterix wouldn't like that. But this is the principle. Give up your healthcare jurisdiction and we'll cut you a check. That doesn't make any sense, but that's the plan.
That it gives me no comfort whatsoever that you are indemnified by the government of Canada. That means that the taxpayer has to pick up any losses that you have. And Mr. Kelly's question was a good one. You're buying these bonds at inflated prices. As interest rates return to normal, bond prices go down, bond prices are inversely correlated.
And I think that our motion of this morning deals essentially with the compassion that we must feel for those who not only are victims of the disease, but also the people who are on the front lines day after day. And throughout the Christmas period or the holiday period, they will continue to focus all their efforts and expose themselves without taking into consideration the risk that they run. It's no coincidence. We're the day after fiscal update from the government, and the Liberal government tabled this update, this economic update, and it's like a big dose of cod liver oil, and they're shoving the huge deficit down our throats, and they say, don't worry, we'll pay tomorrow. And usually when you say that, we'll never pay, because you think that something is going to happen later that will free us up from us. But in the case of this government, they won't be there. This government will create a debt that perhaps in some ways is justifiable, but in others is not. And simply to say it, you're shoveling forward. And just imagine that if you shovel the snow forward, it's other people who will have to then take up the shovel. What are they doing? They're saying, immediately we're going to pass this deficit. And in the spring, once we start to distribute and administer the vaccine, people will forget that they will have had 6 or 8 or 12 weeks later than the others. They'll be less afraid, and then there'll be the deficit that is while they're afraid, so that it's justifiable. But when the budget comes in the spring, they will announce gifts, my friends, that will make no sense. The Christmas that we won't have on December 25th, well, watch out. At the end of March, it's going to fly in every direction. And we understand, obviously, but there are analysts other than me that are saying that this is an election kind of play. If in walking in provincial areas of jurisdiction, perhaps it's like an election campaign. If the government thinks that they're dealing with various issues, it's like an election. The government thinks that it's an election campaign, but I have some news. We are going to stand up. We are going to always call on preservation of Quebec's areas of jurisdiction in the areas of health. I was saying to a journalist earlier that if we urgently need $10 and you have $5 and I have $5, but it's your area of jurisdiction, well, I'm going to give you my $5. And you're going to save both of us because you have the expertise in that area. And a federal government that does not administer the hospitals, it doesn't manage the nurses or the doctors. It's not the one that hired the orderlies. It doesn't have the expertise when it comes to managing the healthcare system. Not only is it keeping its own $5, but it's keeping the $5 of the other guy.
News and Greetings by Canadians for Canadians. Safe Space Cafe. Have a good day.